By the time you finish watching this video, another group of seniors somewhere in the world will hear a life-changing sentence: you have dementia. That's not an exaggeration. That's happening roughly once every minute. But here's the question almost no one is asking. What if getting older isn't the real trigger? What if memory loss isn't starting in the brain, but in the medicine cabinet? Every day, millions of seniors swallow pills they've been told are safe, routine, even necessary. Some are prescribed by doctors, others are bought freely over the counter. No warnings, no red flags, no mention of what they might be doing to the brain long term. Yet emerging research is painting a very uncomfortable picture. Studies now show that certain extremely common medications may quietly interfere with memory chemicals, starve the brain of critical nutrients, or even accelerate cognitive decline, all while symptoms are dismissed as normal aging. And I can tell you from years of clinical experience, I've seen patients decline mentally long before anyone questioned their medications. That's why in this video, I'm breaking down 5 of the most common drugs linked to brain fog, memory loss, and increased dementia risk, ranked from concerning to absolutely critical. And the most dangerous one on this list isn't even a single pill. Before we begin, take a moment and think about this. What medications do you take every single day? Did your forgetfulness or mental fog begin after starting one of them? Drop that in the comments. We read every single one. Now, let's begin. Number 5. Proton pump inhibitors, heartburn meds. Prilosec, Nexium, omeprazole. These medications are everywhere. They're prescribed for heartburn, acid reflux, GERD, and for many seniors, they're taken daily for years. They're often described as gentle, protective, almost harmless. But inside the body, proton pump inhibitors, or PPIs, do something far more serious than most people realize. They aggressively suppress stomach acid. And while that may calm reflux symptoms, it also disrupts your body's ability to absorb vitamin B12, magnesium, and calcium, nutrients your brain desperately needs to function properly. Vitamin B12 in particular is essential for memory formation, focus, mood regulation, nerve protection. When B12 levels drop, the brain doesn't fail loudly, it fails quietly. People begin to notice subtle confusion, slower thinking, forgetting names or recent conversations, mental fatigue that feels like just getting older. But research suggests it may not be aging at all. Large population studies have found that long-term PPI users showed a significantly higher risk of developing dementia-like symptoms compared to non-users. And it doesn't stop at nutrient depletion. PPIs have also been associated with increased amyloid activity in the brain, the same toxic proteins linked to Alzheimer's disease. Here's the most troubling part. Many seniors stay on these medications indefinitely because when they try to stop, the acid rebound feels unbearable. So the pill continues, and the brain quietly pays the price. This doesn't mean PPIs are evil or should be stopped suddenly, but it does mean they should never be treated as set-it-and-forget-it medications. In many cases, safer step-down approaches exist, but they're rarely discussed unless you ask. And the next medication on this list isn't starving the brain, it's sedating it. Number 4. Benzodiazepines, anxiety and sleep meds. Xanax, Ativan, Valium. At first, these medications feel like a miracle. The racing thoughts slow down, the anxiety eases, sleep finally comes. For many seniors, benzodiazepines are prescribed during some of the most stressful moments of life, after a loss, during illness, or when insomnia becomes unbearable. And in the short term, they work. But here's what almost no one explains clearly. Benzodiazepines don't just calm anxiety, they chemically sedate the brain. They amplify GABA, the brain's main inhibitory chemical, which slows down neural activity across wide regions of the brain. At first, that feels like relief. Over time, it feels like this: mental fog that never fully lifts, slower thinking, trouble forming new memories, feeling emotionally flat or disconnected. Many seniors describe it the same way. I don't feel anxious anymore, but I don't feel like myself either. Long-term studies have consistently shown that seniors who use benzodiazepines for extended periods face a significantly higher risk of cognitive impairment and dementia, especially with long-acting versions like Valium that linger in the body and accumulate in brain tissue. And here's where things become truly dangerous. The brain adapts to these drugs, which means stopping suddenly can cause intense anxiety, panic, agitation. Sleep can become nearly impossible. The nervous system rebounds aggressively. This makes the medication feel essential, even when it's the very thing causing the decline. So people stay on it, month after month, year after year. Meanwhile, the brain becomes slower, less flexible, and less capable of forming new memories. This does not mean benzodiazepines should never be used, but in seniors, they should almost never be a long-term solution. When used continuously, they don't just mask anxiety, they quietly trade short-term calm for long-term cognitive cost. And what makes the next medication even more unsettling is that it's often marketed as modern, safe, and brain-friendly. Number 3. Paroxetine, marketed as Paxil. This one is especially dangerous, not because it's rare, but because it looks completely ordinary. Paroxetine is prescribed every day for depression, anxiety, and panic disorders. It's classified as an SSRI, the same family as many newer, widely trusted antidepressants. And that label creates a false sense of security, because paroxetine is not like the others. It's the only SSRI with strong anticholinergic properties. That matters more than most people realize. Acetylcholine is one of the most important chemicals in your brain. It's essential for memory formation, attention, learning speed, mental clarity. As we age, acetylcholine levels naturally decline, so when a medication further blocks it, the brain doesn't just slow down, it struggles. Research following older adults on different antidepressants found a clear pattern. Seniors taking paroxetine showed measurable declines in memory and attention. The decline appeared within the first year. Other SSRIs did not show the same effect. That means the issue isn't antidepressants as a category, it's this specific drug. The cruel irony is, paroxetine is often prescribed to help seniors feel more emotionally stable, yet over time, many patients report difficulty finding words, forgetting recent conversations, trouble concentrating, a growing sense of mental dullness. The medication meant to improve quality of life ends up quietly eroding it. That's why major geriatric organizations have taken a clear stance. Paroxetine appears on the Beers criteria, an official list of medications considered potentially inappropriate for older adults due to safety concerns. Still, many seniors remain on it for years simply because no one revisits the prescription. The solution here is often straightforward. There are other antidepressants in the same class that do not block acetylcholine and are far better tolerated by aging brains. But the conversation rarely happens unless the patient or family asks. And now we move to a category of drugs that many seniors don't even realize they're taking.
Number 2. Antipsychotics, off-label use in seniors. Seroquel, Risperdal, Zyprexa. This is where the story takes a deeply disturbing turn, because many seniors taking these drugs don't even know they're on an antipsychotic. These medications were originally designed for severe psychiatric illnesses, conditions like schizophrenia and bipolar disorder. But today, they're often prescribed to older adults for entirely different reasons: trouble sleeping, agitation, restlessness, difficult behavior, especially in hospitals and nursing facilities. And that's the problem. Instead of asking why a senior is restless or confused, pain, fear, overstimulation, poor sleep, the solution is often a pill, a very powerful pill. Antipsychotics work by aggressively suppressing dopamine. Dopamine isn't just about pleasure or mood. It's essential for motivation, executive function, working memory, emotional responsiveness. When dopamine is pushed too low, the brain doesn't simply calm down, it shuts down. Families often notice it first. A loved one who once laughed and told stories becomes flat. Eye contact fades, speech slows, personality seems to disappear. Many describe it the same way. They're still here, but they're not them anymore. Large studies following older adults show that seniors prescribed antipsychotics for behavioral symptoms experience faster cognitive decline, higher risk of stroke, increased risk of sudden cardiac events, severe sedation leading to falls and hospitalization, and in some cases, these medications are started for convenience, not medical necessity. That's the hardest truth. The decline that follows is often blamed on aging or progressing dementia, when in reality, the brain is being chemically suppressed. This doesn't mean antipsychotics should never be used. In rare cases, they may be necessary. But when they're used casually, long-term, or without full transparency, the cost to the brain can be devastating. And now we reach the most important part of this entire video. Because the #1 threat to cognitive health in seniors isn't one drug, it's a pattern. Number 1. Anticholinergic polypharmacy. The silent combination effect. The most dangerous medication isn't a medication at all. It's the combination. You may have expected one specific pill to top this list, but the greatest threat to memory and cognitive health in seniors is something far more hidden and far more common. It's called anticholinergic polypharmacy, and chances are it's happening right now without anyone realizing it. Here's what that looks like in real life. A senior takes a sleep aid at night, a bladder medication during the day, an antidepressant for mood, maybe something for allergies or pain. Each drug on its own may cause only mild mental fog, but together, they stack. Many of these medications block acetylcholine, the brain's primary memory and learning chemical. When acetylcholine is blocked from multiple directions at the same time, the brain doesn't adapt, it deteriorates. Neurons fire less efficiently, connections weaken, memory centers begin to shrink. On cognitive testing, the result can look almost identical to Alzheimer's disease. And here's the most alarming part. Most seniors have no idea this is happening. No one ever explained which medications are anticholinergic, that over-the-counter drugs count too, and that the combined burden matters more than any single pill. Large population studies tracking hundreds of thousands of older adults have found that those with the highest anticholinergic burden face more than double the risk of developing dementia over time. Not 10%, not 20%, more than double. And yet, this condition is almost never discussed during routine doctor's visits. But here's the part that should give you hope. This form of cognitive decline is often preventable, and in many cases, partially reversible when caught early. When problematic medications are identified and carefully reduced, not stopped suddenly, but tapered safely, many seniors experience clearer thinking, better memory, improved energy, and a return of personality and engagement. The brain is far more resilient than we once believed, but it cannot heal while being chemically suppressed. The solution does not require a miracle drug. It requires a complete medication review. Prescription medications, over-the-counter drugs, sleep aids, allergy pills, even supplements. Doctors and pharmacists have tools to calculate anticholinergic burden. Once you see the full picture, safer alternatives often become obvious. And that makes anticholinergic polypharmacy the most dangerous and most preventable cause of drug-induced cognitive decline in our aging population. Now, I want to hear from you. Which of these medications are you or a loved one taking right now? Have you noticed brain fog, forgetfulness, personality changes, mental slowing after starting a new medication? Are you willing to ask for a full medication review this week? Share your experience in the comments. Your story might help someone else recognize a problem before it's too late.